Most people describe COVID-19 as a global health crisis. That is true, but incomplete. COVID-19 was also a major test of government capacity, communication, coordination, emergency powers, and public trust. In simple words, it raised one difficult question. What happens when governments must make life-changing decisions before fully understanding the crisis? When the virus began spreading, governments had limited information. They did not fully understand how dangerous it was, how quickly it spread, which treatments would work, or when vaccines would arrive. But they still had to act. Waiting too long could cost lives. Acting too aggressively could damage jobs, education, businesses, mental health, and personal freedom. This is the central challenge of crisis governance. Leaders must make urgent decisions using incomplete evidence. The first major test was preparedness. Many countries had pandemic plans, but COVID-19 exposed the difference between having a plan and being ready. Some governments lacked protective equipment, testing systems, hospital capacity, trained staff, reliable data, and clear responsibilities. Preparedness is not measured by documents. It is measured by whether systems work under pressure. The second test was speed. Governments had to purchase medical supplies, expand hospitals, support businesses, and introduce emergency rules quickly. But faster action also created risks. Some contracts were awarded without normal competition. Governments sometimes paid inflated prices or purchased unusable equipment. Emergency procurement must therefore be fast but still documented and reviewed. Urgency should reduce unnecessary delays. It should not eliminate accountability. Coordination was another major challenge. National governments, local authorities, hospitals, schools, police, businesses, laboratories, and public health agencies all needed to work together. When these organizations issued conflicting guidance or failed to share information, public confusion increased. The healthcare system also faced enormous pressure. Hospitals needed beds, oxygen, equipment, and trained professionals. But a hospital bed is useless without doctors and nurses. COVID-19 showed that public services need more than buildings and machines. They need trained people, strong supply chains, reserve capacity, and effective management. Public communication became equally important. Scientific advice changed as researchers learned more about the virus. Changing guidance was not always evidence of incompetence. Policies should change when evidence changes. The bigger mistake was pretending there was no uncertainty. Good crisis communication should explain what is known, what remains uncertain, what action is being taken, and why might the guidance change. COVID-19 demonstrated that public trust is part of national infrastructure. Governments could introduce rules, but they still needed citizens to cooperate. People were more likely to follow restrictions when they believed the threat was real. The rules were fair, and leaders followed the same rules themselves. When powerful officials ignored restrictions, trust and compliance declined. Lockdowns also affected people differently. Professionals could work from home. Restaurant workers, drivers, cleaners, and small business owners could lose their income immediately. Children with laptops continued learning. Others lacked devices, internet access, or quiet study spaces. The same restriction created very different burdens. Governments therefore introduced wage support, business grants, loans, and unemployment payments. These programs protected many people, but they also created problems involving delays, fraud, and eligibility. Schools became another difficult issue. Closing them could reduce transmission, but it also harmed education, childcare, nutrition, and mental health. There was no option without consequences. This reveals one of the biggest lessons from COVID-19. Crisis policy is often not a choice between good and bad. It is a choice between competing harms. Emergency powers also raised concerns. Governments restricted movement, travel, gatherings, and business activity. Some restrictions were necessary, but emergency authority must remain temporary, proportionate, legally justified, and independently reviewed. Vaccines demonstrated what coordinated science, public investment, and private expertise could achieve. However, unequal vaccine access also showed the limits of global cooperation. Wealthier countries received supplies earlier, while poorer countries waited. Misinformation created another serious challenge. False health claims spread rapidly online. But governments also damaged trust when they spoke with too much certainty or suppressed reasonable questions. Authorities must distinguish between proven falsehoods, unsupported claims, and genuine uncertainty. But here is the brutal truth. COVID-19 exposed both the necessity and the limitations of government. Society could not manage the crisis without public authority. But governments also made mistakes, wasted money, issued inconsistent rules, and sometimes communicated poorly. So COVID-19 was not simply a story about a virus. It was one of the largest governance stress tests in modern history. At the Learning Studio, we will examine whether governments were prepared, acted responsibly, protected vulnerable people, communicated honestly, and learned enough to manage the next crisis better.